Medicare. Oh, yes. Sorry, I did want to let you know that this is going to be recorded. It will be on YouTube. I'm not exactly sure when it'll come up, but you can look for it on NKA Idaho on YouTube. So if there's something you missed, you can go ahead and go back and search for it. So welcome again to the class on everything you needed to know about Medicare, and it's a lot of information. And Brad, I don't know how you're going to cover it in just a couple of hours. Just briefly, I wanted to let you know that the NKA, also known as New Knowledge Adventures with AARP, it's a volunteer-driven organization, and it was established in 2015 in the Treasure Valley. It's all volunteer-based. I, as a facilitator and volunteer for AARP, a volunteer. Our presenters are volunteers. If anybody is interested in volunteering, let me know in the chat and I'll go ahead and provide an email address to our volunteer coordinator and she can get a hold of you. Right now if you wanted to ask a question, go ahead and put it in the chat, and I believe Brad's just going to have occasional breaks in between his topics to view and answer some of those questions. And I may interrupt him with a couple of questions here and there. Brad's been a certified Medicare counselor for 6 years, and I will let him continue on introducing himself and letting everybody know, what he does with his Medicare. And I believe you work for the state, don't you, Brad?
That's right. I work for the Idaho Department of Insurance. So that's the regulatory agency for the industry. And the Department of Insurance provides the Sheba Program, which is a free Medicare counseling resource for all Idahoans.
Can you, that Sheba, can you spell that out? Because that's an acronym.
Yeah, it's really sexy sounding, isn't it? It does not, it doesn't pan out as well as you would hope. It's Senior Health Insurance Benefits Advisors. So we have 3 offices statewide, one here in Boise, where I'm choking to death, and one in Coeur d'Alene and one in Pocatello. Obviously, we can't serve all Idahoans with just those 3 offices. So we train volunteers and certify, once they finish training, we certify that they are qualified Medicare counselors. It takes about, on average, 4 to 6 months for people to finish the training. It's quite extensive, lots of on-the-job supervised counseling, in addition to all the online and book work that they have to do. And they take up to, I actually just certified one gal after 2 years of being in the training. So it's done at your own pace. If anybody's interested, it can be quite rewarding. Frankly, I've been a volunteer coordinator for 12 years in different capacities, and it's really hard to find volunteer work that is as satisfying as helping people understand Medicare, helping people who have problems with their Medicare, helping them resolve it. It can be really intimidating, extremely complex, and you can't imagine the relief they feel once they have a handle on it, or they find a solution to a problem that they just thought was insurmountable. So if anybody's interested afterwards, I would be more than happy to talk to you about how you can be involved. We have about 120 volunteers statewide. So a nice big organization. And our volunteers work right now, virtually 95% of them are only counseling over the phone, which is required an additional amount of training and expertise. It's a lot harder to do this over the phone than it is in person, as you can imagine. So we've gotten really good at it over the last year and a half. But we counsel over the phone. We do have folks in each region who will see people in person if it's absolutely necessary at this point. But we're trying to avoid that as much as possible. When in normal times, we see people at lots of community centers around the state. So local libraries, senior centers, other agencies who allow us to use their facilities and equipment to do counseling. So it really is a community-wide organization. And we like to do our best to make sure that we have somebody at least in every county, if not every community in the state, so that people have access to expertise right where they live. In addition to what we're going to be talking about, my presentation today is really aimed at the people who are new to Medicare, somebody who's just turning 65 or possibly eligible for Medicare due to disability. Those are the two main reasons you might be eligible. But that we, in addition to counseling those folks and helping them get started, we also help people who are already enrolled. They have lots and lots of questions and run into a number of problems. And so we take Medicare complaints here at the Department of Insurance and the Sheba Program and work to resolve those through the filing of appeals and grievances, either with the individual plans or with CMS and Medicare, Social Security, whatever agency is involved. We'll dig in deep and help get those things resolved. There are lots of things like enrollment issues where somebody thought they got enrolled in a plan, but the plan is saying, nope, didn't happen, is common this time of year, or will be in January, certainly. Some folks feel like a service they receive should be covered, but their insurance company is saying that it's not. We'll help resolve those issues. There's a wide degree of the kinds of things that Sheba digs into. Any questions about any of that? I have, you would think after all this time I would have our phone number memorized. I still can't remember it. But I'll make sure that you have our contact information before this is over.
Hey, Brent, I have a quick question.
Yeah.
I cannot volunteer if I'm in the industry. Is that right?
You can't volunteer if you're a licensed agent.
Yeah. Okay. So because I sell Medicare as a broker, I cannot volunteer because it's a conflict of interest or something like that. Is that right?
Correct. Yeah.
Okay. Thank you. I just wanted clarity on that.
A perceived conflict. Yeah.
Yeah. Gotcha. Thank you, sir. I appreciate it.
Absolutely. Yeah. Thanks for asking. But for you brokers or licensed agents, we are also a resource for research. And I take calls every day from agents who have a Medicare question that they just are unsure of and are looking for some clarity. And we'll dig into the CMS manuals, which I don't know if you've ever looked at those, you really don't want to ever do that. We'll dig into those for you and find your answers. So we're a resource not only for consumers, but also for folks in the industry.
Thanks. Yeah, that's how I got involved in this. Is I called you guys because one of my clients had an issue that led me down to the ARP path, and I wanted to join this class to listen to the amazing presentations you guys do, because we use you guys as a resource all the time for my clients. So I appreciate what you do.
Oh, wonderful! It's nice to hear. Thank you. Now he's totally oversold my presentation, and I'm going to have to live up to that. So yeah, thanks for that too. Okay, so with that lengthy introduction to who I am and what we do here, let's get into Medicare. I hope most of you are interested in Medicare. Some of the few of you who I can see don't look like you're ready for it, frankly, but we'll assume that you have an interest in Medicare. So I would typically start off with, I'm gonna share my screen here. Now I had sent some of these handouts to folks, and hopefully you got them. If not, you can contact me. I'll be glad to make sure you get them. I better share before I start. moving around. Whiteboard. So I try to, when somebody's getting started on Medicare, most people have taken a look at it or talked to a friend or family member who's already involved, and they get really intimidated really quickly because it sounds extremely complicated. I know I thought it was when I first started doing this. So what I like to do is try to make it as simple as possible. And frankly, for somebody who's starting Medicare, it can be really simple. Most people just don't know what they need to cut away or ignore when they're first getting started. And there are so many rules and so many exceptions to those rules that it's really easy to get lost in the weeds. So we're gonna work to stay out of the weeds, answer those questions from folks who are maybe new to Medicare. I'm glad to answer any of your questions, but I may ask you to put them on hold if they do get down a rabbit hole somewhere, okay? So where do we start? Let's start with what a lot of people call original Medicare. Lisa, can you see this this handout here? It says your Medicare coverage choices.
Yes,
Okay.
we can see it. We can see your, it's not just the document on your screen though. We're also seeing the top part. Sheena, is that something that could be corrected, or
How's that?
is that good enough? Can't hear you, Sheena. Is that good?
Good.
Okay.
Okay. Thank you,
Yeah.
Sheena. Okay. So original Medicare. This is the federal health care plan, comes provided by the federal government. You obtain it. And let's talk about, before we get too far into this, let's talk about what we want to know when we get done here. We want to find out how to enroll, how to obtain all the insurance pieces that we're going to talk about. We want to know what they're going to cost, always what they're going to cost, right? We want to know what benefits they're going to provide and what's going to be left over. How much are we going to have to pay if we use medical services while we're on Medicare? Okay, so pretty simple. 3 or 4 things that we need to know about each piece. And there are only 5 pieces. Okay, so already not terribly complicated. So when you're starting Medicare, the first thing you've got to consider is, do you want to enroll in Part A and B? Okay, you can see those two over here. These are called original Medicare, traditional Medicare. Comes from the federal government. You enroll through Social Security. Okay, so you can go to do that one of 2 ways. You can call your Social Security office locally and tell them you're ready to enroll in Parts A and or B. Okay, or you can go to ssa.gov and enroll online. If this is a possibility for you, I highly recommend it. The Social Security offices are notoriously difficult to get into, get a hold of, get somebody to actually speak to you, and then make an appointment to enroll. Enrolling online at ssa.gov takes about 10 minutes. Okay, so if you can do it that way, that's the way I recommend you do it. Well, let's talk about what these are. And let me back up just a hair. If you're turning 65, the first question you need to ask yourself is, do I actually want Part A and Part B Medicare? And the answer is, there's 2 answers to that. If you're going to be retired and you're not going to be insured through an employer, active employment any longer, you're probably going to want Part A and B. If, however, you're going to keep working past the age of 65 and your employer is going to continue to insure you, then as Medicare says, you're insured through active employment and you don't have to enroll in Part A and B. There won't be any penalties when you want to enroll later. And there are good reasons why you may not want to enroll, especially in Part B. And we'll talk about that here in a moment. So Part A, Lisa,
Greg,
yeah.
Yeah, it was my understanding that if you are on Social Security, you are automatically enrolled
Oh,
in
thank you for that.
original Medicare. Is that correct?
That is correct. You're
Okay.
enrolled, if you're getting Social Security benefits, either the retirement benefits or benefits from disability, SSDI, then Social Security will enroll you automatically when you're Medicare eligible. And for SSDI, that's after in the 25th month of your disability claim. For somebody who's turning 65, that's going to be the first day of your 65th birth month. Okay. If you're not receiving Social Security benefits prior to enrolling in Medicare, not only will they not enroll you automatically, they will not alert you to the fact that it's time for you to enroll in Medicare. Okay, so we do hear on occasion from folks who just missed their enrollment deadline because nobody woke them up and they weren't paying attention and they missed it, which causes complications. So Part A, let's talk about Part A first. The Part A hospital insurance, as it says here, I like to call this inpatient coverage, okay? Because it does cover you in the hospital, but it only pays if you've been admitted by your doctor. It's a really important distinction. Part A will not pay for an emergency room visit because those are all outpatient. Most ICU visits, as we hear a lot about these days, are outpatient, surprisingly. And as you know, most surgeries are done on an outpatient basis these days. So Part A will not pay for any of those things. You have to have your doctor admit you or be admitted by your doctor before Part A will pay. Okay. Part A, if you or your spouse have worked 10 years or more, paid into Social Security, then you've paid for your Part A. So there is no cost to you to have Part A. So premium free, which is why most people who are going to continue to work and be insured through their employer, they go ahead and enroll in Part A. It provides a little bit of secondary insurance for most people. So it pays part of the balance of any hospital bill after their employer insurance pays, and it doesn't cost anything. So no reason not to enroll in Part A. Okay. There is a deductible associated with Part A. It's a little over $1,400. So this is one I like you to keep track of if you're taking notes. We want to keep track of the things that Medicare doesn't pay for, so we can keep track, or we can discuss ways to cover those costs later on. So the first one is this $1,400 Part A deductible. If you're admitted to the hospital and you have Part A, you'll pay $1,400 day one. After that, Part A pays 100% of the costs of the next 60 days. Okay, so not a bad deal, but I don't know about you, in my world, $1,400 is a major disaster. Okay, out of pocket, just don't want to have to do that. So let's keep track of that and discuss ways later on how to cover that $1,400. Another important thing to understand about that $1,400 is maybe you got $1,400 stashed away and you could manage that. The $1,400 deductible, most deductibles are annual deductibles. So you pay it once a year and you don't pay it again for the rest of the year. The Part A deductible is, now it's more complicated than this, but for our purposes, we're going to describe it as a per occurrence deductible. You could be responsible for that deductible every time you are admitted to the hospital. So if you had a really bad year and had 6 hospital admissions, you'd owe the $1,400 each and every time. It's more complicated than that. As I said, you may not owe them, but we can talk about those later on if you have questions about that. Just remember that we probably want a way to cover that deductible later on. Part A also covers other things that we probably don't need to discuss as folks who are new to Medicare. You're probably, God forbid, you're worried about hospice coverage, but Part A covers hospice care. It covers skilled nursing if you get out of the hospital and you need therapy in a hospital type setting. It'll cover that. So there are lots of other things that it covers, but the big one is inpatient hospital coverage. Any questions about that?
Brad, there are a couple of questions.
Mhm.
There's a couple of questions. If I collect widow's benefits, will this automatically enroll me? It's the same like if you're on regular Social Security, isn't it? It'll automatically enroll you when you're 65.
That's right. If you're getting any benefit from Social Security, no matter the reason, retirement, widow benefits, SSDI benefits, then you'll be auto enrolled into Parts A and B.
Okay. And then another question, doesn't the work group need to be 20 plus people to count? I'm not sure what that's in reference to.
I don't know. I'm betting that Reese asked that question. That's just,
Yeah.
yeah. So yes, more complicating things. But if your employer has to have 20 or more employees for Part A to pay secondary. If your employer is small and you're being insured through your employer and they have 20 or fewer than 20 employees, then Part A will actually pay first. So good question, Reese. Thank you. In which case you would want to enroll. And let's talk about this. If you worked for a small employer that was actually providing insurance, which is relatively rare. But if you were, then you would probably want to enroll in Part B. Now, for most people who are going to continue working after 65, they defer Part B because Part B costs $148.50 a month. Okay. And as a secondary payer, it doesn't provide enough coverage. It pays a portion, 80% of the balance of any outpatient bill. So just like Part A was inpatient coverage, Part B is outpatient coverage. And if you're working, it's going to pay the 80% of the balance, which really probably isn't worth $148 a month. So most people defer Part B if they're going to continue working. If you're working for a small employer, you're going to need Part B because Part B is going to be a first payer, not a second payer. So as I said, Part B costs $148.50 a month. We'll talk about ways that you can have that paid for you down the road, but most people are going to pay a Part B premium no matter what. And again, $148.50 a month, that's the cost. It's inpatient or outpatient coverage, which means if you're in the emergency room, if you're having a knee replacement, if you're at your doctor's office, outpatient coverage, Part B is going to pay its share. And its share is going to be 80%. Okay, if Part B pays for virtually anything except preventive services, it pays 80%, leaving you with 20%, which is not bad at all. It's as good as most insurance, most health insurance that employers provide or the marketplace provides. However, there's one big difference. Most of those insurance plans provide a protection from catastrophic type expenses. They put a cap on how much you are responsible for in any given year. And most of them call it an out-of-pocket maximum. So for instance, most Medicare Advantage plans have out-of-pocket maximums around $5,500. That's about average. So during a year, if you spent out of pocket $5,500 on your health care, then the plan would cover the rest of your expenses 100% for the rest of the year. That's your out-of-pocket maximum. Part B provides no such cap. So if your doctor bill is $100, your share of the bill is $20. If your bill is $100,000, it's $20,000 for you. Okay, and that just keeps going up and up. So this is the second big expense that I want you to take note of. Really, and this is really one of the two major ones. You really want to cover that 20% in some way. Okay. This is people who just get Part B and nothing else to cover that 20%. They're the folks you hear about who are in bankruptcy because of their medical expenses. Now, I mentioned some things that Part B covers 100%. There's a long list in the Medicare and You book. When you get ready to start Medicare, send you a book that looks like this. And then they'll send it to you every year updated. And it has a list of preventive services, things like screening colonoscopies and services to help prevent or stop smoking and things like that. Medicare Part B covers those 100%. Some of them have limits and some of them have, you can only get them once a year or once every 5 years. There are rules, but when Medicare covers those, it covers 100%. Okay, so that's Part A and B. We've talked about what A and B will cost, when you can get it, how you get them, what benefits they provide in general, and what your share of the cost would be if you just have Part A and B. Any questions about those, Lisa?
No, somebody asked about Medicaid. If you are on Medicaid, what do you do? Are you covering Medicaid later?
Yeah, great question. I'd like to put that off though. Okay, I will get to it.
So I did have a question on the Part B. So when you turn 65 and they automatically say that you're covered under Part A, if you chose to put off Part B, but you weren't working, then you go ahead and say, okay, 5 years down the road, I decide to do it. Is there some sort of penalty if you didn't get it when you turned 65 and got Part A?
Okay, well, yes, let's talk about the penalties. There's no, for 99% of folks, 99.9% of folks, there's no Part A penalty. Okay, if you get Part A premium free, then you can delay enrolling in Part B as long as you, or Part A, as long as you want, and there will be no penalty when you decide you want to enroll. Because there is a premium for Part B, there is what's called a premium penalty. If, for instance, you're not working, or your employer only has 10 employees and insures you, and you decide not to enroll in Part B, and then 2 years later you decide you do want Part B, you'll pay a higher premium than you would have if you enrolled when you were first eligible. It's just like auto insurance in this country. You know, if you go a year without auto insurance and then you try to get yourself insured again, they're going to charge you a higher price. This is no different. People don't like that penalty word, but that's what it is. So trying to encourage you to get involved in the system at the earliest possible date. It's not an enormous penalty, but it does add up, and it is a lifetime penalty. It doesn't go away. So for Part B, the penalty is 10% of the cost of Part B premium for every month you don't have. You have to not have it for 12 full months before it actually kicks in. So that would be $14 if you went a full year without Part B when you could have had it and you didn't have any other insurance that was creditable for Medicare, meaning employer insurance or an Obamacare plan, basically. Then you'd have that $14.80 penalty added to your premiums the next year when you do enroll. Okay. That's the way it works. So if you're insured through your employer through active employment, there's no penalty if you enroll within your window. When you decide to retire, you've got an 8-month window to enroll. If you enroll during that 8-month window, there's no penalty. If you wait 2 years to enroll, there's going to be a penalty. Make sense, Lisa? Okay.
Yeah, I know it is complicated,
Mhm, mhm.
but yeah, was my understanding, that there wasn't a penalty if you put it off without having other insurance.
Yeah.
So, yeah, okay, great.
And
Thank you.
it's a good question to ask. I've got a gentleman who's waiting a call back from me right now, who had an insurance plan prior to enrolling in Medicare. And he assumed, he was paying good money and it was providing good coverage. And his assumption was that he could just keep that and for a while and there would be no problem. What he didn't realize was it was not creditable for, meaning it's a term Medicare uses, sorry. It means that it was just as good as a Medicare plan. It was not, and Medicare gets to define which ones are and which ones aren't. It wasn't, and so he's got a premium penalty, and I'm going to have to call him later on today and explain that to him.
So if someone did have good health insurance going into retirement, would you recommend, or is there a reason to or to not still get the Part B, even if you did have good health insurance going into retirement?
Sure. What I'm going to tell everyone who calls, if you have insurance through your employer and you're going to continue to work and it's cost effective, it's not costing you more than $200 a month, then you should probably stick with your employer insurance until you decide to retire. Okay, and defer Part B. No reason to pay that extra premium. Once you decide to retire, you need to start talking to someone about enrolling in Part B and getting the other pieces in place. Okay.
So if you, like, I have federal insurance, health insurance. So I'm not into that 65 age yet, but when I do turn 65, they're going to send me the Part A. Would it be beneficial for me to have the Part B along with my federal insurance?
Okay, this is the part where we all get to hate on Lisa because she has gold-plated federal insurance. And Lisa, my answer to you is really, it depends. There are dozens of federal plans. So I don't even try to know them all, but most federal plans are actually better than Part B. And I don't know if I would say most federal employees, but most of the ones I talk to end up not taking Part B. Now,
Okay.
And the reason is it will always be a second payer and it's not worth the $148.50. Now, that said, if you decide to change your mind down the road, it's not, your federal plan is not creditable once you retire. It's not creditable for Part B, so you will pay the premium penalty if you decide to enroll in Part B.
Gotcha.
The
Okay.
danger for federal employees and some military folks, veterans, which I think is a real shame, is that while Part A and B have been incredibly stable over 50 years, Congress just hasn't messed with those. They're less hesitant to mess with veterans benefits and federal retirees benefits. So the chances that those benefits can change are higher than the chances that Medicare's could change. And in which case, there's no way to plan for that other than taking Part B and just being overinsured in case. So I don't have any great guidance for you other than that, Lisa.
Okay. Another question. I am a disabled vet and I'm not sure why I need Medicare A or B. If I drop them both, what's the downside?
Thank you. Yeah, good questions. So for veterans, if you have regular VA benefits, not TRICARE or TRICARE for life, then you may not want Parts A and B or anything else. If you feel very comfortable and certain that you are only going to use VA facilities and VA benefits to cover your medical costs, then you're covered. Like I said, Congress is not above messing with your benefits, and those can change. And it's not unheard of, and we all like to use the one example, one of the examples that we have here of the guy who, was a vet, was fully covered by the VA, but he went elk hunting and he fell and broke his hip and he had to be life flighted out. And he ended up with a $17,000 ambulance bill that the VA won't pay. Part A would have covered a piece of that. Or Part B would have covered a piece of that. The VA is not going to. So if you want to be insured for anything that may happen outside the VA system or that you may need outside the VA system, you want to consider enrolling in Parts A and B. If you have TRICARE for life, which is another veterans benefit, then you have to enroll in Parts A and B because they're going to be first payer. That's a really great program. It's really great insurance, but it's worthless if you're not enrolled in Medicare.
Okay, another question. If a person is going to work till 67, at 65, they're going to get Part B. Then when they retire at 67, they can get Part B.
I think they had that right. Yeah. Most people in that situation go ahead and get Part A when they turn 65. And then when they retire at 67, they get Part B and some other things that we're going to discuss later.
Okay. All right.
Okay.
That's all the questions for now. Thank you.
Awesome. Reese, how am I doing? Did I miss anything?
You're the expert. I'm just here to listen. I think you're on point with everything. It's just really exciting to hear that you guys are offering this type of knowledge, because 99.9% of seniors have no clue what they're doing, and this is a good baseline for them to be able to do it. So thank you again, Brad.
Oh yeah, absolutely. Yeah, you're right. I mean, who wants to know this stuff, right?
I do, but that's what I do for work.
Right, unless they're paying for it. They're
Yeah.
paying us, right? Okay, so we understand now traditional or original Medicare, or at least I hope we have some. Now it gets really, you would think, looking at my little chart here, that it's going to get complicated. It's really simple. You only have one decision to make at this point. If you're starting Medicare, you only have one choice. Do I want to get all those expenses that we talked about plus prescription drugs? That's the third one. So we've got the Part A deductible that we want to get covered. We've got the Part B coinsurance, the 20%, and prescriptions. Prescriptions can bankrupt you in this country, right? So you really want to get Part D. Lots of people try to talk me out of it, and it's certainly your choice, but I highly recommend it. So there are two ways to cover those expenses. There's something called a Medigap plan, and there's something called an Advantage plan, and that's all. There's nothing else, okay? You're going to hear all kinds of stories on television about benefits that you may be eligible for. Let me tell you now, you are eligible for them. And they are all included in one of these two things, and we're going to talk about them. And these are the only choices you have. And all the benefits that you may be eligible for are included in what we're going to talk about now. Okay, so now when they advertise that stuff, you're going to be able to get up and get some more ice cream, which is, instead of paying attention. All right, so I like to start, since we started with original Medicare, I like to stay on that path for a while and go to the Medicare supplement or Medigap policies. Okay. And here's why, because the Medigap plans allow you to keep the federal Medicare Parts A and B. They're supplements, as the title says, Medicare supplements. They supplement Parts A and B. What that means is Medicare, when you go to the doctor, let's say you go to the doctor and get some blood tests run and the bill comes to $400. Part B is going to pay its 80%. So your bill is $400, Part B is going to pay $320. Balance of the bill is $80. Your Medicare supplement is going to pay that $80. Now there's some deductibles, small deductibles and some other things, but for our purposes, it's just important to understand that your Medicare supplement is going to pay the balance of that bill. So instead of coming to you, it's going to go to your Medigap company and they're going to pay it. Okay, that's all they do. If Medicare says, yep, this is a Medicare covered cost and Medicare pays its share, the Medigap plan is obligated to pay its share of the balance. Okay, super simple. That's all they do. If Medicare doesn't pay, the Medigap plan owes nothing. And it's also simple in that your doctor or the hospital doesn't even need to know that you have this Medigap plan. You show them your Medicare card, they're going to bill Medicare, and Medicare pays its share, and Medicare forwards the balance of the bill to the Medigap company. Your doctor never even gets involved in that. So here's the first big advantage of keeping the federal plan versus anything else, using a supplement. You can see any doctor anywhere in the country you want. There are no networks that you have to worry about. You don't have to say, Mother, may I, and get somebody's permission to see a specialist. If you want to see a specialist in Salt Lake or Seattle, Boston or Boca Raton, I don't care. You can go see them. And if it's a Medicare covered service, Medicare will pay, your Medigap plan will pay its share of the balance. So that's the first big advantage of the Medigap plans. Another advantage I like to point out is how simple that makes planning for your medical expenses. If you're like me, you've got an HMO provided by your employer, or maybe you've got an Obamacare plan, which require you to use network doctors and hospitals. So you got to be careful about who you see, or you may not be covered at all. It's also really hard to tell how much you're going to pay, right? Especially if you're going to the hospital. The hospital is not going to tell you how much you're going to pay, and then you're going to owe a percentage of that. I don't know. So 20%, I don't know, is really tough to budget for, right? With a Medigap plan, you're going to pay the monthly premium, and there may be a small deductible that you pay annually. With Plan G, for instance, the most comprehensive plan available to most of you, there's a $200 Part B deductible. You pay that annually. So we go back to our doctor's visit. First doctor's visit, you'll pay the $200 deductible. Then Part B pays 80% of what's left over, and your Plan G will cover the rest. After that, you'll never see a doctor or hospital bill the rest of the year. So you pay the monthly premium, you pay the $200 annual deductible, and that's your out of pocket for medical costs. That's how you protect yourself from bankruptcy due to medical costs. Okay. Now there's a range of plans. They are labeled plans A through N. We can talk more about the range, but it's getting pretty small. The system is kind of antiquated, you would call it maybe. And a lot of these plans just don't make sense anymore because the coverage isn't any better than plans that you can get for less money. So we end up here, I think, well, I should say, I should just keep this to myself. When I'm talking to folks, I usually just talk about Plan G. Unless you're older, if you turn 65 before 2020, you're eligible for something called Plan F that actually pays that $200 deductible. It's the only difference between F and G. Plan G covers everything aside from the deductible. There's a Plan N, used to be a better deal. 6 years ago when I started, you could save enough on premiums to maybe make that make sense. It seems to have gone up enough that I almost don't like anymore, but Plan N may be worth looking at. And then now there's the only other one I really like. And Reese, I see you making faces. You're welcome to jump in here because I think some of these are worth debating. But I really like people to take a look at Plan G, H, D. It's a Plan G with a high deductible.
Yeah, I mean, when we obviously represent both options to our clients, but if we're doing a supplement, 95% of the time, it's going to be a Plan G. I agree with you. I think it makes the most sense.
Yep. The reason I say the GHD can make sense is you can get it for more than $1,200 a year less than Plan G, the full Plan G, but it's got a $2,400 deductible. Now that deductible word scares a lot of people off, but it's not a true deductible. And here's why. Most deductibles, like that Part B deductible, you pay that before Medicare pays anything. Every year you go to the doctor's office, the first $200 is on you. Okay, that's a deductible. With the Plan G deductible, you still have Part A and B paying their share of any bill before you reach the deductible. So Part B is still going to pay 80% of a doctor's visit, still going to pay 100% of preventive services. Part A is still going to pay 100% of a 60-day hospital stay after you pay the $1,400 deductible, right? But once you've spent $2,400, then you get the 100% coverage for the rest of the year. Why is this a good deal? Remember, one, a full Plan G, you're going to get for right in the ballpark of $150 a month right now, probably a little less. Plan GHD, you're going to get for just under $40 a month, right? If you go the other way with the Advantage plans that we're going to talk about in a minute, which is the other alternative, your out-of-pocket maximum there before you're covered 100% is going to be something like $5,500, which is more than twice as much, right? So you still get really good catastrophic insurance. This is insuring you from catastrophic expenses at a really reasonable price and giving you the advantages of the federal healthcare system, which allow you to see, whoever you want. So, when we see this happening a lot here in the Treasure Valley for people who need transplants, and that's one of the most dramatic examples I could use, but we see this frequently. People who need to go to Salt Lake because you can't get a transplant in Boise or anywhere else in Idaho. And people who need to go to Salt Lake and have a Medigap plan have no problem finding a doctor, getting treated. People who have Advantage plans are often turned away. So it's a real situation and an important one. Last thing I think you need to know about Medigaps, if I'm not forgetting anything, is that this is the one piece of Medicare that's allowed to ask you about pre-existing conditions. And if they can ask, they can make decisions based on what they find, right? And they can decline to insure you, or they can charge you a higher rate, or they can not insure you for certain conditions for a certain period of time based on those questions. So that's why this decision is really important initially, Medigap or Medicare Advantage, because you have a window of time when they're not allowed to ask those questions. It's called a guaranteed issue period or a trial right. I often hesitate to dig into the weeds too much and the difference between those two terms. So I'm not going to do it. Here's what I can tell you. If you buy a Medigap plan when you're first enrolling Medicare, they can't, during your initial enrollment period, they can't ask about your health, and they have to sell you a Medigap plan at the published price, any Medigap plan you want from any company. Okay. And that right lasts for 6 months after your Part B begins. Does that make sense to everyone? I want to go to the next step. I see some nodding. Good. Okay. If you buy a Medicare Advantage plan that starts the day your Part B starts. So if you turn 65 in December, your Part B is going to start December 1st. If your Advantage plan starts December 1st, you actually get a year to make a change. No questions asked. So you can change from an Advantage plan to a Medigap plan anytime in that 12-month period, no questions asked. After that first year, they can and they will ask about your health, and they can make up their own minds on whether they want to insure you or not. So you're not guaranteed to be able to get a Medigap plan after that first year. You can ask anytime you want, but they can say no. So who should buy a Medigap plan? Let me stop, Lisa, and ask if there are any questions before I dig into that.
Yeah, let's see. One question, can you divert this Part D or Medigap plan if you are diverting the Part B until you stop working?
Yeah, you can, if you can't have a Medigap plan unless you have both Part A and B. Okay, so that's the first rule. So if you're deferring Part B, you wouldn't want a Medigap plan to begin with because you've got insurance already. So and when you retire, you do get a guaranteed issue period to buy a Medigap plan. Now it's kind of abbreviated compared to your initial enrollment period, but you do get a guaranteed issue period to buy one when you retire and enroll in Part B. Okay. Let's see. I wanted to show you. You may have to try that. Oh, I got it up here. Nope. Yep. Share. That's not it. So what else, Lisa?
That's all the questions there were.
Oh, okay. Let me see if I can get this spreadsheet up. Not letting me manipulate. There we go. Okay. All right. So who should buy a Medigap? First and foremost, if you already have serious chronic conditions that are going to lead to high medical costs year in and year out, you need to buy a Medigap plan from day one. Things, well, I guess, if you're seeing a doctor or a specialist, especially more than 4 times a year, you probably need to have a Medigap plan. One of the big areas we see people getting really bad advice about this is in dialysis centers. People who have kidney disease and need dialysis, they spend, I think it's about $4,000 a month for dialysis. The dialysis centers actually get paid more by Medicare Advantage plans than they do by Medicare and a Medigap plan. So they have people who are actually trying to squeeze people into Advantage plans. And we hear from them frequently after they find out that they're going to pay that out-of-pocket maximum, that $5,000 to $7,000 out-of-pocket maximum every year. And if they don't come to us in time, there's nothing we can do about it. With a Medigap plan, they would pay, say the plan G, they're going to pay the $200 deductible and the premiums, and that's it, as opposed to the Advantage plans where they're going to keep paying something until they reach $5,000. And obviously they're going to reach that $5,000 mark really quickly every single year. So it costs them a whole lot of money that they didn't need to spend. So that's number one. Number two, people who are just really concerned and can afford the premiums and want to make sure that they're not exposed to those kinds of catastrophic expenses. So what we have here, and I hope you can see this spreadsheet, this is from the Department of Insurance website. You can see these, they're updated monthly, doi.idaho.gov. You'll look for Medigap rate sheets and you'll find them. Like I said, we update these every month. It's the only place you'll find them. And you can see every company down the left that sells Medigap plans on the left. And you can see, I didn't lie, there are plans A, B, C, D through N. And let's just take A, for instance. The coverage for a plan A is much less than a plan G, but you can see the costs are really not very much lower. If you're 67 already, you can buy a plan F from any of these companies, and these are the rates. Plan G, again, as I said, it's actually, you can get it for less than $140 a month right now, and plan G with a high deductible for under 40 bucks. Any questions about that? Okay, gonna keep rolling then. Next question I get a lot is, how do you shop for these Medigap plans? Here's what I can tell you that I think is worthwhile. Like I said in the beginning, one of the things we do here at Sheba is we take Medicare complaints. We get about 5 to 10 complaints a week about Advantage plans and prescription drug plans. In 6 years, I've seen 4 complaints about Medigap plans. This system is just so simple that there's really never anything to argue about, right? There's nothing to complain about. It's really easy to understand for all parties when somebody's supposed to pay and when they're not. And so I don't have any concerns about any of these companies. The way I tell people to shop is to look at the rate sheets, choose 3 or 4 companies that have a premium you can live with, call them all, see who has really great customer service when you talk to them. Because if they're not going to treat you good when you're buying their plan, they're not going to treat you good when you got a question, and buy their plan. The coverage is the same from each company. The coverage is standardized by federal law. So plan G from Aetna is exactly the same as the coverage that plan G from First Health Life Insurance that I've never heard of before and never looked at that one. So the coverage is exactly the same. So really you're shopping on price. Does that jibe with what you see, Reese?
Yeah, I mean, the prices are going to be based on the groups that are covering it, the group on the plan at that age, and the service they get. I would argue that it's better to work with someone like me to buy your Medigap policy, but yes, to what you can say, I know you're limited, Brad. Absolutely, that's a great process.
And I'm glad you interjected that. It's absolutely a great idea to use Sheba, but it is also great to have a good insurance agent on your side who can go to bat for you in the event that problems arise, or can answer your questions when those ultimately arise. They always do. So have somebody you can turn to, and going to an agent to shop is also a good idea. Thanks, Reese.
I did have a couple of questions.
Good.
Can some companies offer Medigap plans at lower rates and then raise the rates? How often can you change companies?
Man, good questions, guys. Always more complicated than I want to get, but that's good. So there, how do I want to get into this? There have been complaints, and I will say, as far as I know, they're mostly complaints from other insurance companies, but there have been complaints about some companies coming into the market with a very low priced plan and then raising the rates faster than average, and then getting out of the market and coming back with a new company name. I would say I haven't seen that that's an enormous problem, but if it's going to happen, it's going to happen at the low end of the market. So if you just want to avoid that possibility, then maybe, maybe you don't go with a $127 Union Security Insurance Company for a Plan G right here. But that said, I can tell you that Transamerica Life at 140 has been one of the low-cost leaders, along with Aetna, for a long time. Central States Health, I guess, if you can find, and you can pretty easily, one of these national companies that you've probably heard of advertising during a golf match or football game, and their price is within 10 or 12, $15 of the lowest cost, that's a really good, safe bet. Who else do I like? It falls into that category. I shouldn't say who do I like. Transamerica and Aetna stand out to me in this regard. 46 GPM, Great Southern Life, those companies have been there for a long time. Omaha Insurance Company is one that has changed its name a couple times, but it's still there at the bottom of the list. Philadelphia American Life has been, although it's not one you probably have heard of, it's been at the bottom of the list for 3 years in a row, I think. So I don't know how much of a problem this actually is, but you can protect yourself by going with one of those larger companies and paying a little bit more, I would say. I can also, I'm not sure I should or can, but I'm going to tell you that the law is going to change in the new year. The legislature wrote a new law governing how these things are sold and that guaranteed issue period. They still haven't made the rules, and it won't get done until they come back to town, and nobody's anxious for that. But in January, they're going to rewrite the rules, and then we'll know exactly how this is working. The way they work now is Idaho is what's called an issue age state, meaning these plans have to sell you, the cost you pay is only related to your age at the date the plan was issued. They can't raise it because you get older. Okay, so you see that this rate sheet is for a 65-year-old non-smoker. Okay, now if you buy this plan when you turn 65, these are the rates you'll get. And Lisa asked about discounts. Right now, Idaho doesn't allow discounts. That may or may not change. I think that's a part of the law, but I'm not certain. The new law. but they can't raise it because you turn 70. They can raise it every year based on inflation and business strategies and what have you. And the average is 5 to 7% per year across the board. That's what we see. And we really don't see any outliers too often. I mean, occasionally a company will come and ask for a rate increase that's above that, but it's fairly rare. But that's what we see. What's going to change is that we're going to what's called a community rated system. So the cost that you'll be charged when you enroll will depend on where you live. I don't know how that's going to shake out. I guess I shouldn't even guess. I have theories, but I'm going to leave it at that. I think that's where the law is going to take us, which I don't know if it's good news or bad news. What I do know is good news is that the other part of the law that's going to be interesting is it's going to allow for some kind of annual enrollment period into Medigaps, not into Medigaps. But if you have to change from one Medigap to another, so if you have one, you'll be able to change to another one and get a better rate, and they won't be able to ask about your health. So a little bit of added flexibility, which is always a good thing. Okay, so doi.idaho.gov, that's where you can see these rate sheets. We have them for every 5 years. So we have them for people under 65, 65, 70, 75, and on up. Smokers and non-smokers, that matters here. And then let's see. We also have at the bottom, there's a list of the Medigap rate sheets from age. And at the very bottom of that list, there's a contact list. And again, you can talk to Reese and get some help finding a company or the company contact information is here.
A couple of other questions. Somebody, and you brought up Aetna, but somebody asked if I'm already with Aetna, should I stay with them? And that was one that you had mentioned.
Yeah, like I said, I don't have one of these, so I don't deal with these companies, and unlike Reese, I don't deal with them professionally. I just know who I get complaints about.
Gotcha.
And I don't get complaints about any of these companies, so I don't have any guidance for you in that regard. I wouldn't have it if my mom had an Aetna plan. Actually, she does. I wouldn't have any problem leaving her on a plan from Aetna or really any of these companies.
Do brokers get paid for enrolling customers?
Reese?
Yeah, I'll answer that.
Yeah, thank you.
Yeah, we do get commission from the carriers for doing our service. The great thing about our business is what we get paid is the exact same across the board, no matter what product we put you in, as far as Medigap or Medicare Advantage, which Brad will go over. So when we go over these plans, we're looking holistically at what's best, or at least let me rephrase that. My company and my team looks at holistically what's best. What other people do, I can't say. But yeah, and there's no increase in price. So if a plan like Brad said was costing you $140 from Cigna, for example, buying it directly from them, you'd buy it directly from us at the same exact price. I hope that answered the question.
Yes.
Thank you, Reese. I appreciate you jumping in on that. And I would say that my only guidance for you on finding an agent is that you find an agent like Reese who is incentivized to show you all the available plans and help you choose from them, not lock you into something without showing you everything that's available.
So real quick, the Medicare supplement one that you just gave us that list, that was like $150 a month for that Part G. That $150 is on top of the Part B $150.
Great point. Thank you, because I want you to keep track of that. So yes, remember, if you're enrolling in Medicare Parts A and B, because you're turning 65 or some of the reason, you're going to pay the $148.50 a month for Part B. And now we're going to assume that you're getting that Plan G, the most comprehensive Medigap plan available. and we're going to say that's $150. Okay, you can get it a little cheaper, you can get it a little more expensive, but let's say $150 just to keep track so we can compare later. Okay, now remember we said that if Medicare doesn't pay for a product or service, then the Medigap plan doesn't pay, and Medicare doesn't pay for what? Prescriptions. So if you get a Medigap plan, you're going to need a prescription drug plan. Okay. And you get these from private insurance companies like Blue Cross and United Healthcare and Cigna and SilverScript. There are half a dozen of them. There are 20 in the new year. There will be 22 Part D plans available. 3 ways I can think of you can compare them. One, you can do it yourself at medicare.gov. If you're getting started in Medicare, it's a really good one to bookmark. Great place to search for, if services are covered by Medicare. Also, it's got something called a plan finder tool where you can compare all the available plans based on your prescription list. I'm certain that Reese has people who will help you do the same thing, as will Sheba, and we're glad to do it for you. Okay. Once you've seen it done, you can probably do it yourself pretty easily. It's a great tool, and we use it all day, every day during open enrollment, as I'm sure Reese does as well.
Yeah, if when you're doing this, you should know before the year starts all your fixed expenses. And if the person that's helping you, or if you're doing it, you can't see that, you need to find someone who can, whether it's Sheba or something like that, because you should know your fixed drug costs, what it's going to cost, what each drug's going to cost each month, things like that.
Yeah, thank you. So, and the plan finder will help you do that. When you're looking at prescription drug plans, they all have a monthly premium. In 2022, the low end, I shouldn't put it that way at all. The least expensive plan is $6.90 from a company called SilverScript. If you're one of those fortunate people who's turning 65 and you're not taking any medications and you're super healthy and you go running in the foothills every afternoon, that's a great plan. Frankly, for a lot of people, it's just as good as a plan that costs $40 a month or more. And if you don't know what drugs you're going to take in the future, there's no way to tell what plan you need anyway. So $6.90. It's a great way to avoid the Part D penalty, because if you don't enroll in a drug plan when you're enrolling in Medicare and you don't have a creditable plan from somewhere else, like an employer, there's a penalty to pay when you do want one. Turns out to be about $4 for a full year. It's 1% of the premium for every month you don't have it. That's 33 cents a month, so about $4 for a whole year that will be added to your premiums when you decide you want one. And again, that's a lifetime penalty. It doesn't go away, so it does add up over the long haul. Now, important to compare these Part D plans every year. Unlike the Medigap plans that don't change, when you buy a Medigap Plan G, it's going to cover exactly the same stuff, provide exactly the same benefits from the day you're 65 to the day you're 105. Okay, not going to change. Part D is going to change every single year. The premiums are going to change. The deductibles are going to change. The copays and coinsurance and the list of drugs they cover are all going to change. It is super important that you compare your current drug plan with what's coming for the new year and the open enrollment period, which is October 15th through December 7th every year. Okay, here's an example. Well, one of the most common calls we get in January and February is from people who didn't bother to change their drugs or their drug plan or compare their drug plan in the open enrollment period. In January and February, they go to fill their prescriptions and the pharmacist says, oh, this isn't covered on your plan. You say, what do you mean? It's always been covered on your plan. Well, they changed their formulary, which is the list of drugs they cover. I bet we talk to 100 people every year who fall into that trap easily. So compare them every year. When you're enrolling for the first time, really, that low-cost plan is the way to go if you're not taking any medications. But if you do take medications, they're divided up into some categories. How am I doing, Lisa? I'm good on time, right? 4:15?
Yes, I think we're scheduled till 5 o'clock.
Okay, I haven't seen anybody dropping off yet, so that's great. Okay. So the drug plan companies, the insurance companies are allowed to divide the drug categories up, or they're divided up. So there's a certain number of painkillers available, and there's a certain number of antacids available, and so on. They have to cover a certain number of those painkillers in each category of painkiller, right? They don't have to cover them all. And they put them on what are called tiers. So the generic painkillers are going to go on tier 1 and 2, and those are going to be very inexpensive. In fact, extraordinarily frustratingly, you may find that your tier 1 and 2 drugs are cheaper if you pay cash for them than if you use your insurance plan. You'll find that I'm no big fan of Part D. Get myself in trouble saying here, but Congress created this so that pharmaceutical companies and insurance companies could make a lot of money, not so that you get your drugs covered. Did I just say that out loud? Nobody's recording this, right? So if you only have tier 1 and 2 generic drugs, even if you have a Part D plan, just so you don't incur the penalty, you might ask your pharmacist, hey, what if I paid cash for these? What would the price be? Very frequently, you'll find that you'll pay less money than if you use your insurance. Tier 3, 4 drugs, those are going to be name brands. You're going to pay a higher percentage of the cost for them. And then there's tier 5 and 6 is something else. Don't go there. So your costs on each plan will differ depending on which plan you have, what drugs you're taking, and which pharmacy you use, because the insurance companies all have Byzantine contracts with the pharmacies to boot. So a plan finder or an agent like Reese or Sheba can help you really narrow down these drug plans. So the way you shop for these is you go to Medicare.gov or one of the other sources, you hit a button that says find health and drug plans. And right now it says preview 2022 health and drug plans. Hit that button. It's going to ask for your zip code. It's going to ask if you have anything like Medicaid or something like that. And then it's going to ask for a list of your prescriptions. Then it's going to ask for your pharmacies, and it'll ask you to compare 3 or 4 pharmacies, 5, up to 5. And then it will give you a list of all 22 available drug plans from least expensive to most based on your prescription list. It will give you an estimate of exactly what you'll pay for each prescription each month of the year. It'll tell you if you're going to fall into the coverage gap, which I will not get into, I swear to God, don't ask me. And it will tell you, so it'll give you a breakdown of what you'll spend at the pharmacy every month. The number it's using to compare these plans is a little complicated, but it's your true out of pocket for your prescriptions. It's going to combine the premium price. So if you're buying that $6.90 plan, it's going to multiply that times 12 and add that to your annual copays. So what you pay at the pharmacy plus that premium, it's adding those together, and that's the number, and it'll be right on the front page as you scroll through the list. It says premium plus drug costs, $500, and the next one down is going to be $516, and the next one down is going to be $607, right? So you're going to find pretty quickly that there are very few reasons to scroll very far down the page. You can go through all 22 if you like. We generally don't have to get through beyond 4 or 5 before people start catching on though. Okay. Now it's also going to tell you, the price it's going to use is at the most economical pharmacy for you, but you can also see how that compares to your current pharmacy, whichever pharmacies you put in. Okay. So that's how to use that. If that sounds complicated or you're just unsure of that, an agent or a Sheba representative, Sheba counselor is glad to do it for you. Okay.
Guys, let me throw something out there for people that don't know this.
Please.
Costco is one of the best places to get drugs, and you don't have to be a member of Costco to use their pharmacy. A lot of people think you have to be a member. You don't, to use their pharmacy. So just be aware of that.
Awesome point, Reese. Thank you. Costco, Save On, surprisingly, which is Albertsons, and Walmart still tend to be the top 3. Fred Meyer is very often in the preferred group, also surprisingly. Those 4 are the ones I tend to see, but it's worth comparing others just to be sure that you're getting the best deal, especially if you're spending a lot of money on your prescriptions. So it's worthwhile to play around with that a little bit. So that's it. So if you're going to stick with traditional Medicare, Parts A and B with a Medicare supplement, a Medigap plan, and Part D, that's it. So for our purposes, let's say on average, Part D is going to cost you $20 a month, which I think is a pretty good average. You're in for right around $310 a month. $148 for Part B, $150 for the Medigap plan, $20 for Part D, so $310, $320 a month. Okay. Now, that's not chicken feed in my little world anyway. So for people who that's just not, within the realm of possibility, the other option is where we would take them to the Medicare Advantage plans. Remember, all this is leading up to the one choice you got to make: Medigap or Medicare Advantage. So let's talk about them. Most people, by the time they get to 65, have had some insurance in this country, mostly from employers. Some of us get it from the marketplace, Obamacare, right? And all of those plans are HMOs and PPOs, which is what the Advantage plans are. What it says right up here: Medicare Advantage plans, or Part C. Love all these clever names. Part C are HMOs and PPOs. What is now? Remember, Medigap plans are Medicare supplements. I think it's important to know that Advantage plans are Medicare replacements. They are not original Medicare. They're taking the place of. They have to follow Medicare's rules, but they're allowed to do it in really different ways. We'll talk about some of those, but they work just like what you're used to from your employer. If you're a state employee, you're insured through Blue Cross of Idaho, and you've got an HMO or a PPO. You pay a monthly premium. You're required to use network doctors and hospitals, or pay a much larger share of the cost, if not all of the cost, depending on your plan. You're going to pay a deductible every year before the plan starts to pay anything. It's going to cover your prescriptions, but with another deductible. You're also going to pay coinsurance or a copay. Just about every time you go to the doctor or hospital, you're going to owe something until you reach that out-of-pocket maximum. And remember, we said those out-of-pocket maximums, the full range is, I think for next year, it's about $4,800 to just over $7,000, depending on your plan. Okay. So the way to choose these things now, one more thing. Well, a couple more things. So remember, original Medicare allows you to see a doctor anywhere in the country you want, any doctor you want, as long as they're associated with Medicare. The Advantage plans are going to require you to see the doctors that are contracted with them. So the further you get from where you bought the Advantage plan, your zip code, your county, your state, the harder it's going to be to find those network doctors. Now, if you travel a lot, you may want to consider going with a national type company like United Healthcare or Humana. You'll have a better luck finding those kinds of doctors. The regional plans, which are every bit as good, still may not have as broad a network if you're traveling around the country. Pacific Source, does really well you find network doctors in Oregon and Washington and Idaho really easily. But if you go to Arkansas, you're out of luck. Same with Select Health, Utah and Idaho, you're golden. California, you're out of luck. Advantages of the Advantage plans. So other disadvantage, just really hard to tell how much you're going to spend from one year to the next on your healthcare. Advantages are they can be really cheap. There are some really good zero premium plans this year and next. So if you're just comparing Advantage plans to Advantage plans, there are some plans that will charge you absolutely nothing for their plan, and they're really good. They have some really great additional benefits that Medicare doesn't cover. They include Part D, so you don't have to worry about that. Not a big worry, but you still have to choose these plans based on your prescriptions because they include Part D. They also include some extras. I used to call them the toy surprises, but they've actually gotten pretty good. If you make use of all of them, they can save you a bunch of money. So I don't really very often use that term anymore. But they include things like dental and vision, discounts to fitness clubs, benefits that provide you a certain amount of money to buy over-the-counter medications like aspirin and cough syrup. That's a couple $100 a year on some of these plans. What else? Hearing and hearing aid benefits, meals delivered to you after a hospitalization. Some of them provide transportation to and from non-emergency medical appointments. So some of these things can be really important for people and can really add up if you're making use of them. So any questions about any of that? Let me pause there and gather. Lisa, any questions about the Advantage plans?
Yes, hold on.
Or anything else?
Yeah, there was a question from when you were talking about the Part D. Was someone said someone was told not to use Good RX if you have Part D. Is that something you know about? And is that true?
Good RX and a lot of those discount programs very often can't do much for Medicare beneficiaries. They're really not intended for them. There are also, the pharmaceutical companies themselves have discount programs for people who can't afford their very, very expensive drugs. And most of those programs are not available to people who have Medicare. That said, there's nothing preventing you from using those discount programs. And if they're available to Medicare beneficiaries, and some of them are, there's no reason I can think of that you shouldn't use them.
Okay, the next question. I have been on a Blue Cross Advantage plan for 3 years, starting at age 65. In a nutshell, what are the options for switching to a Medigap plan, restrictions and considerations?
Okay, good question. So you're past that 1-year window. So any Medigap plan you apply to is going to ask you about your health. Right now is the time to do that though. So you need to disenroll from your Advantage plan during the enrollment period. And you can do that from Friday, from this Friday until the end of March. So you got a big window. But you can ask to enroll in any Medigap plan from any company in Idaho. They're going to ask about your health and they'll make a decision about whether they'll insure you. And if they say, yeah, then you can buy their plan, get all the paperwork signed. This is one where I'm not totally clear on things, Reese, so feel free. But get that contract signed, make sure that you've got the Medigap plan in place, and then disenroll from your Medicare Advantage plan anytime between now and the end of March.
Yeah,
I get
so
that?
yeah, the way it works is starting as of Friday, you have annual enrollment where you can make every single type of change possible and through the first week of December. After that, if you're on a Medicare Advantage plans, the next quarter, so Q1 of next year, you can change that Medicare Advantage plan or disenroll in that plan. When it gets to the supplements, it's kind of tricky, and the new legislature that Brad was talking about, it kind of affects that. I'll throw my contact information in there if anyone wants to reach out and ask me those questions on a more specific basis, not in front of a group, so it's more private. I'll do that, but yeah, that's pretty much on key there, Brad.
Yeah. So yeah, you can change the Advantage plans anytime. There's 3 weeks in December when you can't do it, but January 1st to March 31st or Friday through December 7th, you can make changes in Advantage plans. And one of those options is to get a Medigap plan if you can find a company that will sell you one. And there's no charge and no foul to apply. So if you're interested in one, I would suggest you do that shopping. What else, Lisa?
Yeah, there are no other questions.
Okay.
Looks like you have about a half an hour.
Great. We are right on schedule then.
Great.
So who are the Advantage plans for? Let's see. What do I want you to know about this? Right now, about 65% of people enrolling in Medicare for the first time choose a Medigap plan. That's down. I think it falls a percentage point or so every year as the Advantage plans are able to offer more and more benefits. The Medigap plans are locked into place by federal law. They can't change. And the Advantage plans continue to be able to offer all the bells and whistles that you see advertised on TV. So that makes it, inevitable that that's going to continue. That 65% is going to continue to fall. Medigap or Advantage plans. I don't feel too bad for them because they're the people who are lucky enough to be really healthy and to have enough money to afford a Medigap plan. They're really loath to part with the cash, so they really want the cheap Advantage plan, but they know it's kind of fiscally irresponsible and they should go with the Medigap plan, but they really don't need the Medigap plan because they're really healthy. Too bad. Here's your choices. You're going to have a hard time in that situation, right? The people who don't have a hard time are the people who already have chronic conditions. They really need to be in a Medigap plan if they can afford one. And people who just can't afford a Medigap plan or who really need some of the extra benefits, like dental is a big one. And that's a driving factor. Then they need to be in an Advantage plan. I mentioned that there are some zero premium plans. There's at least one zero premium plan this year, and it's available again next year I can think of, that has outstanding comprehensive dental, or at least as good as you're going to get in an Advantage plan. So it's worth exploring. One of the things that you and your agent or a Sheba counselor can strategize is, if you're one of those people who needs a Medigap plan, but also needs some dental work done, for instance, you could try to game this out a little bit, enroll in an Advantage plan for the first 12 months or the first 6 months. Get your dental work all done and then change to a Medigap plan, right? No reason you can't do that. Reese would be glad to help you do that. I'm glad to help you do that. And you should be strategizing in that way if that's what you need. So those really, let's go back. So we said that fully covered under a Medigap plan was going to cost you right around $300 a month. Fully covered under an Advantage plan, it's a broader range, but typically 148 for Part B plus $0 to $40 a month for Advantage plans. And there are more expensive Advantage plans, but most people find one that suits them, at least in the Treasure Valley, depending on where you live, for around $40 a month. So under $200 a month if you go with an Advantage plan that includes drug coverage. So can really, and you pile on the extra benefits, you can really save quite a bit of money with one of them. Okay. So Medicare simplified. Original Medicare, you have Part A and B, hospital and health coverage. Medigaps are supplements to Medicare. Advantage plans are Medicare replacements from private insurance companies that look a lot like your employer coverage or your Obamacare plan. Those are your choices. Timing is an issue. Are you new to Medicare? You've got that 7-month enrollment period to get enrolled, 3 months before your 65th birthday and 3 months after. And you get started by calling or going online to Social Security. So that's really, we should have stopped there, right? I promised we would dig in a little bit to Medicaid. There are programs that will help with these costs. The number of people in Idaho who need help with these costs is enormous. We talk to folks every single day here at Sheba and help them find out if they're qualified. You can download what we call our Save Money brochure on the Department of Insurance website, doi.idaho.gov. It will tell you the income and asset limits for each of these programs. That's the way you qualify for all of them. They're all based on income and assets. I can tell you in general, the big one is Medicaid. To be eligible for Medicare and Medicaid, your monthly gross income has to be right at $800, $800 a change. So it's not much. If you get full Medicaid, what that does for you is it pays your Part B premium. It pays for, well, don't say that. It pays for your Part B premium. It pays the balance of all your doctor and hospital bills. And it enrolls you in a program from Social Security called Extra Help. The Extra Help program buys your Part D plan, and it limits the cost of your prescriptions to $9 and change, no matter how expensive they are. So could be a $4,000 a month prescription, you'll pay $9 and change. Most of your prescriptions are going to cost under $3 if you have full Extra Help. Medicaid also provides some dental benefits and other things that Medicare doesn't. So it can be literally a lifesaver for people whose income is that low. If your income's a little higher, there's a program called QMB, or Medicare Savings Program. It's also available from the Idaho Department of Health and Welfare. QMB does everything that Medicaid does, except it doesn't provide those extra benefits like dental. So most people don't even notice that it's any different than Medicaid, frankly. 2 lower levels of Medicare savings programs only provide the Part B premium payment. They don't make copays or pay coinsurance or deductibles like Medicaid does. They also enroll people in the Extra Help program. So it does cover their drug costs. And frankly, a lot of the people we talk to, that's the biggest problem they're dealing with, is trying to pay for their prescriptions. So Extra Help can be an enormous lifesaver. You can enroll in extra help by itself. If your income is above the limit for the Medicare savings programs, which is about 1429, I think 1429. If it's above that, you're not going to be eligible for anything from the state. So no Medicaid, no Medicare savings program. But with an income as high as 1640, you can qualify for extra help to get those cost savings on your drugs. And the enrollment there is directly through Social Security. You can go straight to ssa.gov and apply, or call the local office and apply over the phone. Those really are the most effective and places to get help with medical costs and insurance costs for Medicare recipients. Somebody mentioned GoodRx, and there's Needy Meds, which are discount programs aimed at helping people. Typically not available to Medicare patients in some cases. There's one other that I'll mention. It's called the PAN Foundation, PAN, Patient Advocate Network. This is available to Medicare patients. It helps. They give annual direct grants to individuals to purchase drugs. So they'll pay for the most expensive prescriptions, depending if you qualify for the grant. I don't know what the process for application is like, but I have had people who couldn't get their drugs any other way and were able to get them covered by the PAN Foundation. That, my friends, is the Dog and Pony Show today, and all I've got for you, unless you have questions.
There are a couple of questions. One, I can't tell if my husband and I are on an Advantage plan or a Medigap plan. It's through his employee retirement.
Complicated. So there are some employers who purchase Medicare plans for their retirees. The only way to really tell, you should have a membership card. It should have some details. If it's a Medigap plan, it usually will say Plan F or Plan G or something like that. If it's an Advantage plan, it's probably going to say HMO or PPO on it. Those are kind of keywords. Should say Advantage plan. However, Blue Cross is notorious for not putting anything on their cards that's useful.
It's very, very hard to say because it says Plan I, and Plan 3, basically.
Okay, so in these cases, what you need to do is contact your employer benefits manager or the HR department and ask them directly, exactly what kind of plan is this? How does it work with Medicare? Does it work with Medicare? Who's first payer and second payer?
Medicare is primary. We just found this out. Medicare is primary.
Okay.
And then Anthem Blue Cross kicks in secondary.
Okay, sounds like a Medigap plan.
Okay.
But you want to.
But we do get dental and vision.
Mm-hmm.
So and that's why I'm saying there's a little bit of each.
Right. So with those employer benefits, really best to go to the employer for an explanation of exactly what's included.
Okay.
How they work with Medicare, and how you can make changes if you can make changes.
That's the big problem is when we were only offered one plan. If we were moving to Idaho, we were only allowed one choice.
Yeah, we hear that a lot. At least you had the one choice. A lot of folks find out when they move here that they have no good choices compared to what they came with.
I was just going to ask you is it worth it? Is it usually best that we stay with the employer related plan, or should we look into not even using their plan and doing it independently?
Well, you should do that. You should look at the costs and benefits of your current plan, and then come to somebody like us or somebody like Reese who can tell you how that compares to what's available from Medicare, the costs and benefits of going to Medicare strictly,
Okay.
and then you can make a good decision.
And-
But you'll have to get that coverage information and cost information from the insurance company and your employer benefits people before somebody can make that comparison for you.
Okay, and I missed the first couple minutes, and when you say come to us, who do you mean?
Sheba and the Idaho Department of Insurance.
Thank
we're
you.
a Medicare counseling service here at the DOI.
Medical care.
I promised you I would look up my phone number.
That's it.
After 6 years, I would know this by heart. We are here. No, that's not it. I've got it here somewhere.
Well, people can Google it. I mean, it's out
Yeah,
there.
our number is 800-247-4422. And I'm going to give you my direct line, actually, which I do know, not that lame, is 208-334-4276. And if you call me, just remind me that you attended this class. So
Could you repeat that again? I'm sorry.
yeah,
208.
208-334-4276.
Okay, thank you.
Yeah.
And Julie, since you said that you were late, I don't know if you understood that this whole presentation will be on YouTube.
Aha, thank you.
And probably within a week, just go ahead and do YouTube, NKA. And it should show up as one of the classes that was recorded.
Thank you. Thank you very much.
Another question, in general, if I travel a lot, more secure and best coverage with Medigap, is that probably correct?
Yes. With the Medigap plan, you don't have to worry. You can take it anywhere in the country. Also, if you move, you can take the Medigap plan with you. Your drug plan or your Advantage plan are going to have to change if you leave your zip code, basically. Certainly, if you leave the state, they'll have to change. And if you're a snowbird, some of the Advantage plans have started providing some limited ability to take your plan with you and use local doctors as if they were in network. They make it a little complicated to activate that benefit, but it's there and it's growing and improving, but it's certainly not as simple as the Medigaps where you just mind your own business and go where you want, right? So if you're traveling, certainly a Medigap plan is the easiest and most sure way to make sure you're covered. That said, I also should point out that, when we're traveling, most of us are not making your average doctor's appointments or checkups or anything like that. So the Advantage plans are required to cover you for emergencies no matter where you are in the country. Okay. Medicare will cover emergencies. Advantage plans will cover emergencies. So may not really be that big of an issue if you're just traveling. What else, Lisa?
Another question, if I move from Idaho, do I have to change anything?
If you've got Part D or an Advantage plan and you move from Idaho or to Idaho from another state, you will have to make changes to both those plans, either of those plans, yeah.
Okay. It looks like that's the last question on chat. Is there anybody else that has a question? Oh, let's see. Any Part D, does any of the Part D prescription use mail order?
Oh, yeah.
prescriptions?
Yes, absolutely. Both the Part D and the Advantage plans with Part D, most of them have mail order options. Some of them allow you to get a 100-day fill for the price of a 90-day fill, or maybe it's a 60-day fill. I think it's a 60-day fill if you use their mail order pharmacy. So yes, they do have that.
Great.
And that's the thing I always include in a plan comparison is whether the mail order is going to be. It used to be, a few years ago, it used to be the mail order was a really good deal and was often the low cost option, but not as much anymore.
Interesting. There's no more questions on chat. If anybody has any questions, you can go ahead and unmute yourself and ask your question at this time.
The free for all moment. That was kind of disappointing, guys.
Oh, I think everybody, you did such a great job, Brad, that anything that they had questions on is already, you've covered it. So
I hope so. You're welcome to give me a call if I muddled anything up. I'm sure I did. I feel like looking back, I just muddled through the whole thing. So God knows how confused you are at this point. I hope it helped.
no, it was great.
Good.
Hey, Brad, you said something about some handouts that you were going to send out or that you had already sent out.
I did provide them, I think, to Lisa or Sheena,
Yes.
but I'd be glad to send them to you, Jeff, if you want to give me a call or email me. You can send an email to brad.talbot. That's TALBUTT at doi.idaho.gov.
Yeah, you should have gotten them from me maybe 10 days ago. And but my email is starts with the number, so sometimes it automatically gets thrown in your spam box, so you may want to look there. But anyway,
Okay. Can you see the last part of your email address again, Brad?
Yes, doi.idaho.gov.
Okay.
All right. Anything else, folks?
I'll look for that, Sheena. Sorry about that.
Oh, no problem, no problem. Just let me know. If you-
Yeah, either way. Okay. Well, Lisa and Sheena, thanks so much for having me. Appreciate y'all's time and hope to talk to some of y'all down the road.
Yeah,
Thank
thank you so
Thank
much,
you.
Brad. That was awesome. And Reese, thanks for popping in and giving some
Yeah.
other expertise.
Absolutely, Reese. Glad to have you here.
And you know, everybody check on the NKA event. There's more classes coming up. I don't have them listed exactly, but you know, there's more classes coming up through the middle of November. So we would love for everybody to join us. Someday we'll do this back in person, but for right now, it's been nice to be able to connect through everybody and provide all these classes on Zoom. So thanks, Brad. Everybody have a good rest of your day.
Take care.
Thanks, everybody.
Thank you, everybody.
Thank you.
Bye.
Bye.